What do you want to talk about today?
Let's talk about Medicare.
Sounds good. Let's talk about Medicare. So as I talk to people, as we have Medicare clients come in, the thing that's crazy to me is that the government expects people to just know how to handle Medicare. You get the same experience?
Oh, hands down. And it's almost ironic that these people are 65 and older.
Right.
And they're wanting them to get on the computer, sign up for your Social Security website, and they just are very intimidated by that.
Right. So let's just dive in, I guess. Let's tell us about Part A, and we'll just kind of bounce it off of each other. Let's talk about Part A. What is Part A?
The first thing that I think people need to understand is Part A, being the hospitalization part of Medicare, is it's automatic.
Right.
So, I mean, when you see that word FICA on your check as you're younger, then you know that you're paying ahead for Social Security coverage. So that covers your Part A. And a lot of people, especially on Part B, that is something that you don't have to turn on when you turn 65.
Right.
So the Part A is pretty much automatic, but it's generally a good idea to go ahead and set up on SSA.org, Social Security Administration.org. It's always a good idea to set up an account. Not only does it give you a place to set up for Part A, but it also will tell someone in their 40s and 50s approximately what their Social Security income is going to be.
Sure.
As well. So lots of good information there. If you could maybe get one of your kids to help you set up your Social Security account. Or us.
We're happy. We're happy to help you set that up. Yeah, I get that a lot too. It's like, what is Part A? I got this in the mail. That's the other thing that's crazy is the amount of information that our clients receive, just junk mail, right? I can't tell you how many times people have said, I never got my Social Security or I never got my Medicare card. And I'm like, yeah, you probably did, but you probably threw it away.
Yes.
And they'll say, yeah, I might have, because at some point I just got sick and tired of getting junk mail. So I just started throwing stuff away. So.
Absolutely. And good point, Megan, because it's like, I have people that bring their every piece of mail they got to me, and it is, a foot thick. Right. So what happens, and I have people say, how do they even know that I'm turning 65? And the way they know is because the Department of Motor Vehicles, the DMV, has all of your information, which is going to have your dates of birth on there. And so insurance companies are able to get that information from the DMV to let them know that they've got the 6-month window before somebody turns 65. So you're getting all advertisement from every company in the state of Oklahoma. And you're exactly right. They're going to make it look as official as they possibly can to get you to open it.
Right.
So, but yes, they have no idea whether it's their Medicare card or it's a
advertisement. And you're right. They look so real. So, Medicare Part A, let's just kind of dig into that. That's where I get, a lot of questions, the alphabet, if you will, of Medicare. So your Medicare Part A is going to be your hospitalizations, right? So that's going to be any person in the United States who turns 65, they will receive, whether they're working or not working, they'll receive their Medicare Part A card. And that's going to cover any time that you go into the hospital. Then if we go into the next section, if you will, let's talk about Medicare Part B, as in boy. So Medicare Part B is not automatic. You turn on your Part B when you're ready. So you want to talk a little bit about that, and then?
Yes, there are a lot of scenarios. It's kind of funny because you say 55 is the new 65, and it's people are working longer. You used to think 65 was retirement. Right. I mean, that's when you retired. But now I know that you and I have people that are 71, 75. So the main thing with Part B is if you are going to continue to work after age 65 and you're still employed and you have group health insurance through your employer, it's a really good time to sit down and discuss that with us, because you may not want to turn on your Part B. You may want to stay on group. But I think it's worth a conversation, to see if it would be better. Weigh your options.
Right.
Do I want to go straight Medicare? Do I want to stay on my company insurance? And just a quick little note, I get this a lot too. A lot of people think Medicare and Medicaid,
right, are interchangeable words.
Exactly.
And they're not.
mean two completely total things.
I actually got a Facebook message this past weekend, and a lady said, "Could you help me turn on my Medicaid?"
Oh,
and I said, "I think you're referring to Medicare." And she said Medicare/Medicaid, whatever. So I think people, they do, and they don't understand it. And I didn't, before I started working in the industry, I didn't understand the difference between the two terms.
Oh, absolutely. Yes. So back to your point about turning on Part B. If you have insurance through work, you don't want to pay that $143.50. You don't want to pay that every month whenever your work insurance is going to be your primary. So like I said earlier, it's worth calling us and having that appointment, having that conversation. There are all kinds of factors into whether I should turn on Part B or not.
Right.
And I think most of the population gets scared because they hear the word penalty.
Right.
Penalty, the book Medicare and You, whenever you get that, it's like they probably use the word penalty about 50 times.
I think that the Medicare book is almost like reading all the side effects if you were to read the side effects for Tylenol.
Good point.
It's like, I'd never take Tylenol, right? So it's like when you get that big, thick book from Medicare, maybe just don't even read it. I don't know. There's some good points in there. Yeah. But we can certainly help you digest it all, right? In like easier segments.
Well, and I've told you before too, I think I like to consider what we do with people, the cliff notes
of
Medicare.
Absolutely.
Of the Medicare guidebook. Because if you're 65 and you're still working and you get home at night and you look at that book, it is just overwhelming.
Yes.
And what do you do when something's overwhelming? You just put it off.
Right.
So there are, don't get me wrong, there are some penalties involved.
For sure.
But
the other thing though about Part B is, if we've had clients that have done this before, they think that it's, you should turn it on immediately. You should turn on your Part B when you turn 65. And that's not always the case. As as you just said, it's really important to know when to turn on your Part B, because that kind of starts your timer. And we're going to get into supplements and Advantage and everything here in just a second. But it's just really, I can't stress that part enough, that it's so important. I've had so many clients that have turned on their Part B when they turn 65, but now they're 72 and they want to go ahead and retire. And I can't help them get a supplement because their window of opportunity is closed to get that supplement without having to answer the proper medical questions.
Exactly. So that's a really good point. You do, when you lose your open enrollment, I think would be a good word to use for any insurance product. We rely on that word heavily when you don't have to answer medical questions. And I think there are a lot of people out there that say, it doesn't matter to me. I'm healthy. I can answer any medical question you throw at me. I have always referred to it in my career as the line of insurability. One day you're perfectly healthy. You're an Olympic swimmer, and overnight you have chest pains and you're uninsurable. And I think a lot of people take that for granted because being uninsurable is going to put your decisions are going to be very limited.
Right.
Let's just put it that way. So you're exactly right. When you've got to be careful to turn on your Part B, because you could be clicking that box and eliminating a lot of your options.
Yep. So we talked, and earlier you said it was 143. Believe it or not, it's gone up again with inflation. So this year the premium for Part B is $170.10.
Oh
so
my gosh.
$170.10 is the Part B premium. So, and the other question I get is, how do I pay that? Right. So if you are individuals, if you are taking Social Security, then that can just simply come out of your Social Security check. But I also have a lot of people that turn 65 and aren't quite ready to accept Social Security. So that's a whole nother subject. And then for those clients, it's just billed quarterly. And so I just say, keep an eye out for it. That $170.10 times 3 is going to come to your mailbox every 3 months. So keep an eye on that. So we've covered Part A. Again, Part A is your hospitalization. You have a $1,400 deductible, and then the 20%. So for example, you have to have your gallbladder removed. Let's just say that. You would pay the first $1,400, and then let's say that's a $6,000 surgery. You would pay the 20% above that $1,400, correct?
Yes.
So we've got that. That's automatic when you turn 65. That 20% is what scares people, and we're going to talk about how to fix that here in a second. Mm-hmm. And then you've got your Part B, which is going to be your doctor's visits. With your Part B, you're going to pay the first $233 to see your doctor. Usually that's about 3 doctor's appointments. Most primary care physicians charge around about, and it varies depending upon where you are within, the United States. But here in Tulsa, is where Darla and I are based, we find that most of the time primary care physicians charge anywhere from $70 up to $105 is kind of the top end. So I tell clients, hey, you're going to pay the first couple of times that you go in and see your doctor, and then you're done. I mean, you actually don't have to pay anything else to see your primary care after that $233 is met.
And that would be, that is from January to December.
Yeah, that's a great point. Thank you.
So if you started your Medicare July 1,
mm-hmm.
and then you paid your $233 deductible, then January, you're going to have to hit that again.
Perfect. Yep. So, and that's the same thing with Part A. Yeah. Yeah. These deductibles, that's a great point. These deductibles run through a calendar year. Right. It's not just when you turn 65. So it will be, your deductibles will start January 1st, and then they will restart, I guess, December 31st is when your deductibles restart.
Yes, and those deductibles can change. So just like I totally messed up the Part B premium because it went up this year, the deductibles go up every year.
Can go up. Yeah.
Can go up, yeah.
I don't think we saw it go up last year, but I think it did go up the year before. So yeah, premiums change, and so do your deductibles every year. That's one thing that everything's changing. It's constantly changing. So
yes, and usually going up. They never hear insurance is going down.
Right, for sure. That's the other thing is I had a lady not too long ago. We were talking, and she said, "Golly, things have changed so much since I helped my mom sign up for Medicare." And so I mean, to your point of it's always changing. It's like, God, you think you've got it mastered. You helped an aunt or you helped a mother or someone sign up for Medicare, and now it's my turn. And you think, oh, I've got this. I don't need help with it. And again, it's always changing. So that's why you need our help, right?
Absolutely. I think a lot of phone calls that we get, I think you could back me up, are from children of parents.
Yep.
And now they're dealing with, I'm needing, to put my mom in an assisted living or a long-term care facility or, something unfortunate. And they start digging into insurance at that point, and they're calling us saying, why did my mom do that? Why did my mom go that route?
Right. Those are the hardest phone calls.
Very much so. And I think it's important that kids get involved with their parents' decisions. I know
absolutely
you don't want to. I mean, you'd like to. But absolutely. I mean, it is, I can't stress enough how big of a decision it is to decide how you're going to supplement your Medicare and how that will affect you in the future.
Perfect. So With that being